Good day everyone, I'm Joyce Apot-Urolfan from BSN 212M Group 50, and today I'm going to demonstrate the Leopolds maneuver. A Leopolds maneuver is done to our pregnant patients and it usually performed after 36 weeks of gestation. So this is conducted in order for us to determine the position, presentation, as well as the engagement of the fetus and aid in location of the fetal heart sound. Additionally, this is done to help our pregnant patients to be prepared for their labor and to determine if there will be complications that will likely to develop during the delivery or if the patient will require a cesarean section. Prior to the conduct of the procedure, we will prepare the necessary materials such as soft pillow, a towel or blanket, and also our stethoscope. And since we already have our needed equipments, I have also performed hand washing or hand hygiene to ensure the cleanliness of our hands and to deter the spread of microorganisms. We will also protect our patient's privacy by closing the doors or draping the curtains and now, let's greet our patient. Good morning, ma'am. How's your day? Okay, so first, ma'am, I would like to introduce myself. I'm Joyce Apot-Urolfan from Davao Doctors College, and I will be your student nurse for today po. May I see your wristband, ma'am? Can you please state your complete name?
Eugene Chris,
And your birthday, please.
February 29, 2004.
Okay, thank you, ma'am. So, for today, ma'am, we will be doing the Leopolds maneuver. So, basically, it is a technique we use for us to determine the position of your baby inside your uterus. So, what I'm going to do, ma'am, is to feel your abdomen and add a little pressure so that I can do the procedure effectively. Would that be okay with you, ma'am? Alright, so do you have any questions or clarifications before we proceed? Okay. So, alright. Before we start, ma'am, I encourage you to void first for you to feel comfortable throughout the procedure. So, it is important for our patients to empty their bladders before the procedure since it promotes comforts and allows for more productive examination. And if not, it creates a distended bladder that may obscure the fetal contour and slightly deviate the uterus. So if our patient is done voiding, we will assist them in a supine position with one pillow under their head. So ma'am, I need you to lie down and slightly flex your knee. So, a flex knee is helpful since it relieves the tension in the abdominal musculature. And placing a small rolled towel beneath our patient's hip helps to prevent any supine hypotensive syndrome. So, ma'am, we will begin the examination and I will need to expose your abdomen. Would that be alright, ma'am? Alright. So make sure to only expose the area that will be examined to avoid unnecessary exposure. And if the patient is right-handed, stand at the patient's right while facing her. So now I'm going to perform the first maneuver, which we call the fundal grip. So, face the patient and use both hands to palpate the uterine fundus to determine which part of the fetus lies in the upper part of the uterus. So, it may be the fetal head which feels firm, separately from the trunk, or it may be the breech, which feels softer and moves with the trunk. And now, let's proceed with the second maneuver, which we call the umbilical grip. So what I'm going to do is to palpate downwards on the sides of the abdomen with gentle but deep pressure using the tips of my hands. So this is done for us to determine where is the fetal back. So the fetal back feels firm, smooth, and has a hard resistant surface, and also to feel the fetal extremities, which feels like small irregularities. And for the third maneuver, which we call the pollex grip, so to do this, I'm going to place my hand over the symphysis pubis and grasp the lower uterine segment with my thumb and fingers of my right hand. So this is done to determine if engagement has already occurred. And now, let's proceed to the fourth maneuver, which we call the pelvic grip. So what we're going to do is to face towards our patient's feet and move our hands over the sides of our patient's uterus towards the pubis. So this is done to determine the degree of flexion of the fetal head. Since we're done with the maneuvers, we will now locate again the fetal back and listen for the fetal heart tone for 1 full minute. So, fetal heart rate monitoring is important for us to detect changes in the normal heart rate pattern during labor. So, ma'am, we're done with the procedure. I'm going to cover. So, ma'am, are you comfortable with your position? Are you okay? Alright, that's good to hear. So, ma'am, I have determined that your baby is at your right side and in a cephalic position, which means that the baby's head is at the lower part of your uterus and it is already engaged. So, this means that your baby is at the ideal position of or for labor, okay? Alright, and your baby's heartbeat is 125 beats per minute, which indicates that it is normal. Alright. So, do you have any questions or clarifications before we end our... Okay. So, thank you so much for your participation, ma'am. Have a great day and stay safe. So, after performing the procedure, perform hand washing and document the findings. So that's it for my return demonstration. Thank you for watching. Bye-bye!